welcome. In this video, we will go over some key points regarding screening for hepatitis during pregnancy. The questions for our learning include: why do we screen for hepatitis during pregnancy? What screening is done for hepatitis during pregnancy? Why don't we test the entire hepatitis profile? What if hepatitis B surface antibody is positive? How do we manage the baby? What if hepatitis B surface antigen is negative? What if it is positive? How will we manage the baby of a hepatitis B surface antigen positive pregnant woman? What if the hepatitis C antibodies are positive? How would you manage the baby of a hepatitis C positive pregnant patient? So to answer the question, why screening for hepatitis during pregnancy is done, we refer to the guidelines by the American College of Obstetrics and Gynecology, the Royal College of Obstetrics and Gynecology, and the NICE guidelines, which all recommend that screening of pregnant women should be done for hepatitis B and also for C. The reason that we screen is because hepatitis B and C can be transmitted from the mother to the baby during childbirth. So if you can identify those mothers who have an infection with B or C, then we can intervene to prevent this transmission to the baby, thereby reducing the burden on public health. Early identification of hepatitis infection in pregnant women will enable timely treatment and management, and this will reduce the risk of complication for both the mother and the baby. If the pregnant woman is found to be infected with hepatitis B, her newborn can receive the hepatitis B vaccine and immunoglobulin shortly after birth to prevent infection. Through screening, you can identify infected women so they can be monitored more closely for liver function and potential complications. This ensures they receive the appropriate care and support. Early detection and management of positive women can help mitigate the risks of serious liver disease and other health problems. From a public health point of view, by identifying women who are positive, we can understand the prevalence of hepatitis infection in the population at large as well as the pregnant population. This aids public health efforts to control and to reduce the spread of these infections. So the next question that we ask ourselves is, what screening is done for hepatitis during pregnancy? The routine testing for hepatitis includes hepatitis B surface antigen test. The purpose of doing this test is to detect current hepatitis B infection. And we do this by a blood test that checks for the presence of the hepatitis B surface antigen, indicating active infection. The other hepatitis test is for hepatitis C antibodies. And the purpose of doing this test is to screen for hepatitis C infection. This is done through a blood test that detects antibodies to the hepatitis C virus, indicating exposure to the virus. If this test comes back positive, then further testing is done through HCV RNA test to confirm active infection. There are some optional tests which may be conducted by a physician or by the obstetrician, and if these results come back positive, then the patient is referred to a physician. These tests are hepatitis B surface antibody test. The purpose for doing this test is to check if there is immunity against hepatitis B. And again, this test will be done through a blood test, and it will detect antibodies which indicate either a past infection or a vaccination. Hepatitis B E antigen is done to assess the infectivity and replication status of the hepatitis B virus. The test is done through the blood, and it checks for the presence of the hepatitis B E antigen, which is associated with higher levels of virus replication and infectivity. The hepatitis B core antibody test will detect past or ongoing hepatitis B infection, and it can indicate either past or chronic infection. So what is a complete hepatitis profile testing include? A complete profile will typically include a range of tests to detect and to differentiate between the various types of hepatitis infections. It will assess the stage and the activity of the infection and determine the immunity status. Here are the common components of a comprehensive hepatitis profile. A hepatitis B surface antigen will detect current Hep B infection. A Hep B surface antibody test will determine immunity to hepatitis B. A hepatitis B core antibody will detect past or ongoing hepatitis B infection. Hepatitis B E antigen will assess infectivity and replication status of the virus. Hepatitis B E antibody will monitor the course of hepatitis B infection. Hepatitis profile also includes hepatitis C testing. So hepatitis C antibody test will screen for hepatitis C infection, whereas hepatitis C RNA will confirm active hepatitis C infection and measure the viral load. Hepatitis A testing, again a part of the profile, is done through Hep A antibody, which is a total anti-hepatitis A virus to detect past or current hepatitis A infection. Hepatitis A IgM antibody will diagnose acute hepatitis A infection, which is ongoing currently. A positive hepatitis D antibody test indicates that a person has been exposed to the Hep B D virus. So HDV virus infection requires the presence of hepatitis B for replication and for propagation. So a positive hepatitis D antibody test indicates exposure to the hepatitis D virus, suggesting either past or current infection. Since the hepatitis D virus requires hepatitis B virus for replication, the presence of hepatitis D virus signifies a co-infection or a superinfection scenario. Further testing will include hepatitis D virus RNA as well as liver function test to determine the infection's activity and to guide appropriate clinical management. The implications for management are quite important when hepatitis D virus is detected, because hepatitis D virus can cause more severe liver disease in comparison to hepatitis B alone, including a higher risk of cirrhosis and liver cancer. So the question is, why do we only screen for Hep B and C during pregnancy? Why don't we screen for the entire hepatitis profile? So to answer this question, we find there are some situations when we do the entire profile, and these situations include the following. If you are exposed or if you are treating a high risk population where the women are at a high risk for hepatitis infection, for example, those with history of intravenous drug use, multiple sexual partners, HIV infection, or those who have been exposed to blood products may undergo a full hepatitis profile. This includes populations where already the prevalence and the incidence of hepatitis is very high. We will also check the hepatitis profile if the pregnant woman already has abnormal liver function tests, or if she has symptoms which are suggestive of liver disease, for example, jaundice, fatigue, abdominal pain. These are non-specific symptoms, but if they seem to be very severe and are pulling the patient's health down, then a comprehensive hepatitis profile may be conducted to determine if a hepatitis infection is the cause. Other situations where the entire profile will be checked include previous hepatitis infection. If a woman has a known history of hepatitis infection, she will undergo a full hepatitis profile to assess the current status and to monitor for any changes or reactivation of the virus. So if a woman is found to be infected by either hepatitis B or C, then a detailed hepatitis profile will be essential before starting the antiviral treatment. This will help to determine the best course of action for managing the infection during pregnancy. There are some parts of the world where the prevalence rates are so high that comprehensive hepatitis screening will be part of routine prenatal care for all pregnant women. If a woman is pregnant and has a positive hepatitis B surface antibody test, it generally means that she has immunity to hepatitis B. This immunity can result from one of the following situations. She may have a previous vaccination, in which case she will develop the protective antibodies against the hepatitis B virus, or she may have had a past infection and she may have developed immunity to the virus. If the hepatitis B surface antibody test is positive, then there are certain other considerations. So generally, we will not check for hepatitis B surface antibody in the pregnant woman, but if it has been done by accident, then you need to do a hepatitis B surface antigen test also to indicate and to find out if there is a current infection. A negative hepatitis B surface antigen test alongside a positive hepatitis B antibody test will confirm immunity without an active infection. In addition to the antigen test, you will also need to do a hepatitis B core antibody test to check anti-hepatitis B core antibodies, which can help to differentiate between immunity due to past infection and immunity due to vaccination. If the hepatitis B, C, or core antibody test is positive, it suggests past infection. But if it is negative, it suggests immunity is due to vaccination. So what if the hepatitis B surface antibody test is positive? It means there is no active infection. A positive anti-hepatitis B surface antibody test will generally indicate no active hepatitis B infection, which is reassuring for the health of both the mother and the baby. There is no risk of transmission. If there is no active infection, the risk of transmitting hepatitis B to the baby during childbirth is nil or negligible, and the woman will continue to have routine prenatal care with no added testing for hepatitis or a need for specific hepatitis B interventions. So what if the hepatitis B surface antigen is negative? If the hepatitis B surface antigen test is negative, it means there is no active hepatitis B infection. And if the pregnant woman has a negative hepatitis B surface antigen result and a positive hepatitis B surface antibody test, it means that she is immune to hepatitis B, likely due to previous vaccination or recovery from past infection, and there is no risk of transmission of the hepatitis B virus to the baby. What if the hepatitis B surface antigen is positive? If the hepatitis B surface antigen is positive, it indicates an active hepatitis B infection. And this means that a patient has currently got an active infection. This has got some very serious implications for the baby because there is a risk of vertical transmission of the hepatitis B virus to the baby during childbirth. How will the newborn be managed if the mother is hepatitis B surface antigen positive? As there is a risk of transmission of the virus to the baby during childbirth, so special precautions need to be taken. The newborn should receive hepatitis B immunoglobulin and the first dose of the hepatitis B vaccine within 12 hours of birth to prevent infection. The baby will also require further testing and monitoring by doing additional tests such as hepatitis B E antigen and hepatitis B DNA and liver function test to assess the level of infectivity and liver health. Moving on to hepatitis C infection. How will you manage the baby of a hepatitis C antibody positive patient? There is no conclusive evidence to suggest that elective C-sections will reduce the risk of hepatitis C virus transmission. Minimizing invasive procedures such as fetal scalp monitoring and reducing the chances of prolonged rupture of membranes will reduce the risk of hepatitis C virus transmission. If a mother is hepatitis C antibody positive, then how will we manage the baby after birth? So at birth, a thorough clinical assessment of the newborn will be performed. However, immediate testing for hepatitis C virus RNA or antibodies is generally not recommended as it may reflect maternal antibodies rather than true infection. However, delayed testing has to be done at 2 to 3 months of age. At this time, a hepatitis C virus RNA testing will be performed and a positive result will indicate active infection. If this is also found to be negative, then a repeat testing will be done at 18 months of age to confirm or to exclude chronic infection. In addition to these precautions, these babies of mothers who are hepatitis C antibody positive will also require some other important interventions. The baby should receive all standard newborn care, including vaccinations, according to the routine immunization schedule for the WHO recommendations and for the country. There should be regular pediatric follow-up care, and the pediatrician should be informed and about the mother's hepatitis C virus status for proper monitoring of the infant. Breastfeeding is generally safe for mothers with hepatitis C virus, as this is not transmitted through breast milk. However, if the mother has cracked or bleeding nipples, it is advised to temporarily stop breastfeeding until the nipples heal to reduce any potential risk. We should also test the mother who is hepatitis C antibody positive for other infections such as hepatitis B and HIV, and appropriate prophylaxis as well as management for these conditions should be provided if need be. There is a need for family education and for the parental education to educate the family about the hepatitis C virus, its transmission, and the importance of follow-up testing and monitoring for the baby. Long-term monitoring may be required because of the risk of chronic hepatitis C infection. And such babies should be referred to a pediatric hepatologist for long-term management and monitoring. And this monitoring will include testing and for periodic liver function tests and assessments of liver health. It is important to know that there is no vaccine for hepatitis C virus. And so we must ensure that the baby receives vaccinations for hepatitis A and B to protect against these additional liver infections. So the management of the baby, which is born to a hepatitis C antibody positive mother, focuses on careful monitoring and following up testing to determine the baby's infection status, providing routine newborn care, and ensuring proper parental education and support. Breastfeeding is generally safe and the baby should receive standard vaccinations. Long-term care for confirmed infections includes specialist referrals and ongoing liver health assessment. With this, we come to the end of the video. If you liked the video, then please subscribe to the channel, press the like button, share with friends and colleagues, send comments about this video and other videos that you would like to see, and don't forget to press the bell icon so that you can receive notifications about future videos. Thank you for viewing this video and goodbye.